All right, good afternoon, everyone. Thank you for joining us today for the meaningful involvement of people living with HIV, the cornerstone of positive organizing webinar. My name is Julio Fonseca, and I'm the program manager for the Positive Organizing Project at ADDE United. We just wanted to let you know that today's webinar is being recorded. And so slides and handouts of the recording will be made available at adddeunited.org/webinars. The webinar is being conducted in listen-only mode. So if you have a question that you want to ask, please use the Q&A box in the lower right of your screen. Audio information is provided in the right column, which is above the Q&A box. Really quickly, just to give you a quick introduction of our presenters today, we have Kivale Cadena, who is with Life Foundation in Honolulu, Hawaii, Bart Cordell with the Positive Women's Network, myself, Julio Fonseca with ADDE United, Nana Khanna, also with the Positive Women's Network, and Andy Spieldiner with the U.S. People Living with HIV Caucus, which is also known as the HIV Caucus.
Great, thanks Julio. This is Bart Cordell, and I am the Vice Chair of the People Living with HIV Caucus. We have been in existence since December of 2010, formed in January of 2011, and we came together as a bunch of people living with HIV in an effort to amplify the voices of people living with HIV. We realized that in some ways the intention of meaningful involvement of people living with HIV did not have a go-to organization to really coalesce a conversation, and so the caucus is a coalition of networks as well as independent advocates really attempting to amplify the voice of people living with HIV and to ensure a call to action for both our partners and ourselves as a community around meaningful involvement and supporting each other in meaningful and positive leadership.
So we just wanted to, at ADDE United, provide a quick overview of ADDE United. ADDE United's mission is to end the AIDS epidemic in the United States, and we seek to fulfill our mission through strategic grant-making, capacity building, policy advocacy, technical assistance, and formative research. To date, we've directly funded more than $98 million to local communities and have leveraged more than $115 million in additional support for programs that include access to care for people living with HIV, capacity building for community-based organizations, HIV prevention, advocacy, syringe access, and more. The Positive Organizing Project is funded by Gilead Sciences. We've had 3 project years, and the RFP that has recently been released is for our 4th year. To date, we've funded 29 grantees, and we have reached over 200,000 people through our project work. We do work in close partnership with the U.S. People Living with HIV Caucus.
Wonderful. So as you can tell, we have partnered with ADDE United in significant and meaningful ways around our Positive Organizing Project, as well as around AIDS Watch, and they are a valuable partner to the caucus, and we hope that we are able to provide a lot of significant input to them as well. For the Positive Organizing Project, what the caucus has done has worked to provide assistance for organizations as well as leaders living with HIV and what exactly meaningful involvement looks like, how it can be implemented organizationally, and to provide support throughout the entire grant process. And so we have helped to draft the RFP, revising it each year to sort of help organizations understand a little bit more what is being funded in this very special, very specific project. To ensure the voices of people living with HIV are included in planning. We also are part of the grant review process, and then again, once the grants have been awarded, we will assign a leader living with HIV to partner with each of the organizations to coach meaningful involvement and to help support leaders who might be taking a large step up in leadership engagement, and has been able to partner with all 29 of the projects that have been funded in the past and continue to use those as very meaningful partnerships. So for this webinar, this is an intention to specifically address what meaningful involvement of people living with HIV and AIDS is, what it has been, how it was created, and why it is so important to actually merit a grant and a project with ADDE United. And we feel that by being able to talk about what meaningful involvement is, that it enables us to perhaps help clarify a little bit about when you are writing grants or are looking at developing meaningful involvement in your organization, whether it's grant-driven or not, what that looks like and why sort of we're really specific about what that has come from and what it feels is meaningful when you're engaging people living with HIV and what is not meaningful when you're engaging people living with HIV. And to just sort of frame, before we start getting into the details of the history, when we're talking about meaningful involvement of people living with HIV, there is room for everybody to be engaged in this conversation. As people living with HIV, we have very specific parts where we can join organizations and support them as leaders. As organizations, there are specific places where we can call on people living with HIV to be engaged. As communities, there is amplifying the voice and making sure that people living with HIV are a part of processes that will impact them. And as a political structure, there is also a call to action for people living with HIV to be engaged. And as we will continue to talk about this, we talk about people being engaged, not just as people living with HIV, but also as the right people living with HIV. And I believe Nana will talk about that a little bit more, but just to bear that in mind as we continue to talk about key populations that you might be addressing and how that will be included. So meaningful involvement goes all the way back to 1983 to the Denver Principles. This is a photo of when they took the stage to actually present the Denver Principles, which are often spoken of as a manifesto or as a Bill of Rights for people living with HIV. It was early in the HIV epidemic, and there were not a lot of medical options available. And so as Sean Strube has said, and he's cited down here at the bottom of the slide, he said that we often had nothing left other than our anger. And in trying to focus not just what we were demanding of our caregivers, but also what we were demanding of our community, this Denver Principles came together and had very specific, I would say, rights and responsibilities for everyone who is involved in HIV work. It's significantly profound because it is a group of people living with an illness who came together to actually address how they chose to be labeled and how they chose to be spoken about and how they demanded that people treat them. So it was a true call to action for our community, but it was also a demand about how we chose to be addressed and how we chose to be involved. From it came this very powerful statement that we still continue to see today. And the first is, nothing about us without us. And that is this core value from the Denver Principles, which is that until we are engaged in decisions and policies that are impacting our lives, we feel that they do not address the needs of our community. And the Denver Principles came up with an original framing statement that I think is always powerful, and I will read it out loud. I'm not going to read the slides, but I do read this out loud because I feel it is important to just feel the weight of these words. So in 1983, the Denver Principles stated, from the Advisory Committee on People with AIDS, and we now say people with HIV, we condemn attempts to label us as victims, a term which implies defeat, and we are only occasionally patients, a term which implies passivity, helplessness, and dependence upon the care of others. We are people with AIDS. And then we set forth recommendations that are a core value of meaningful involvement. We talk about the right to form caucuses and to choose our own representatives, to deal with media and to choose our agendas that further and support the needs of people living with HIV. Number 2 is to be involved in every level of decision making. In the early days of the HIV epidemic, many ASOs were led by people living with HIV. That is not quite so common any longer. It is now professionalized, and so it goes back to how do we involve people living with HIV in every level of decision making, and specifically to serve on boards of directors. And then finally, we demand that people living with HIV be included in all AIDS forums, and that includes public policy, that we have equal credibility to engage as participants, and that researchers and doctors and executive directors of AIDS service organizations have experience and have powerful voices, that our voices as people living with HIV, especially with our lived experience, is as powerful. So those are the core values that we come to from the Denver Principles. It's a powerful document. It was written in 1983. Some of the language is a bit dated, but it does, when we talk about going back to our most basic value, this is the frame, and it is important to say that it continues to inspire people living with HIV today. And with that, I will turn it over to Andy.
Thanks, Barb. Hi, everybody. As Barb said, HIV was really, when we started in the epidemic, it became very obvious that not only was HIV an illness, but it was also a highly politicized identity that we inherited. At the beginning, it was largely, people that were associated with people living with HIV, so all gay men and lesbians, people of color, substance users, sex workers, immigrants were identified with this highly stigmatized identity. If you had friends that had HIV or family members, you were associated also. This has changed over time, but at the root of the movement, HIV really borrowed from several other social justice movements that came out. So, for instance, the original HIV activists learned about liberation movements and saw the power of the civil rights movement, saw how Black Power mattered, how different forms of racial organizing really helped challenge government institutions and claim our spaces. In the LGBT movement, we saw with the eruption of Stonewall, the validation that sex is part of the battle and part of our liberation, and that this is supported by the people who came into HIV through feminism and really understanding gender as an organizing principle, that gender equity was important, that sexual and reproductive rights were on the table and needed to be fought for. And you see HIV borrow in kind of the global movements with anti-colonialism, anti-apartheid, the fight for liberation and self-empowerment that happened across the world and still is obviously a hot button issue. And we learned that HIV is a global movement, a global community, and it still remains so. Barb talked about NEPA, and we talked about, this is about why does NEPA matter. And when we think about organizations, when we involve people living with HIV, when we're involved as people living with HIV, then organizations are more likely to really represent our needs. So, we bring to the table our concerns with our health care and our families and our mental health and our immigration status and our sexuality, our right to have sex. And those things should be at the center for organizations that say they represent us. And that's really what NEPA is about, is our ability to be able to say, this is what I think is important. I think housing is important because when I can't have housing, then I'm more likely to do other things that prevent me from leading a healthy life, whether that means being virally suppressed or having good support networks or however we define a healthy life. I think it's really important to think about that. One of the real challenges that organizations are facing now is this kind of, some organizations still have up old social media campaigns because they feel good about it. And these are old HIV ads that might be from the 90s, and they're incredibly stigmatizing. And if people living with HIV were involved and able to really able to get our voices heard, we may be able to say, take that poster down. It makes me feel bad. It makes me feel like I don't want to come back here. And I think something as simple as that, is the start of NEPA, being able to say that I'm uncomfortable in certain places and having somebody hear me. I think in the long run, when we think of the nonprofit world and we think of social justice, I think in the end, NEPA is really about building that kind of sustainable, shareable power, so that it's not just, the outreach worker that speaks to people living with HIV. It's everybody talks to us, and that we have a key role in all of the tables that matter to us. And I think, we've seen organizations over the time make choices that aren't about the people living with HIV that they know. It's about kind of one person deciding, this is what the people living with HIV in my community need. And that's not really a sustainable model. I've been to organizations and been to events. I've organized community events where I thought I really was going to get the community there, and nobody showed up because I didn't really involve the community. And I think there's a lesson there that we should learn. And as you're working on your grants and looking at your projects, think about that. Have you talked to local people living with HIV? Have they given you some feedback on it? Have you asked them, what's wrong with what I'm doing? What am I missing? Because sometimes when you give people a project, they might say, oh, it's fine, but they may not really know what you're asking about. So think about, like, am I missing something? Barb alluded to the fact that we've had early challenges with HIV organizing for people living with HIV. And some of that is, because we've had, deaths. HIV prior to 1996 didn't have any kind of treatment available. And even since then, we still have HIV mortality. We have poor health conditions. As people living with HIV, we have precarious lives. And that means that sometimes we have to bail out because we burn out, we have trauma. Whatever it is, sometimes we just have to not be part of this journey anymore, or we have to take a break. One of the key challenges, it's interesting because I think about this a lot when we tell the stories of HIV, is how often do we tell a story about HIV that really is about cisgendered white gay men being very visible and having power. All the original ACT UP meetings, when we kind of look at the mythology of ACT UP, it wasn't just cisgendered white gay men. There were a lot of women involved, there were people of color involved, there were active substance users, sex workers, but we don't necessarily tell those stories. These people remain invisible. And I think it's important for us to remember that people of color, women, HIV negative and women living with HIV have been involved since the beginning. People of trans experience have been involved since the beginning. People with different immigration experiences, people with different experiences with incarceration. And so even though there's this legend that we talk about, kind of the origin of ACT UP, really, being about cisgendered white gay men, there were a lot of people there. And ACT UP, one of the things ACT UP did was really took diversity, tried to take diversity seriously, and had open forum where people could talk about power issues. I think we also, in the 90s, there was a movement away from community and towards professionalization. You could get master's degrees in HIV or community health or whatever, and I think that left a lot of people out in terms of the meaningful involvement of people with HIV. Often those of us living with HIV, we've been marginalized by education. We've been pushed out of school, and we don't feel comfortable there. So this whole professionalization of the industry has left us out because many of us dropped out of school or didn't want to pursue graduate degrees. And so that's another way in which NEPA was undermined early on. I think one of the key things for us to consider is that as the epidemic became blacker and more feminized, the commitment that organizations had to PLHIV leadership really did waver. We stopped seeing people openly living with HIV as executive directors or in senior management positions or on boards of directors, and we saw more and more this kind of tokenistic approach to dealing with people living with HIV. These historical challenges remain in organizations for lots of reasons. Here we've got a graph of some of the reasons. There's racism, sexism, heterosexism, classism, colonialism, ableism, cisgendered privilege, formal education privilege, HIV status, all the things that when we talk about intersectionality, it's what we're really talking about. How do we make spaces accessible? How do we make people feel, how do we encourage people to participate in the room in a meaningful way? So when we think about it, we have to address the fact that the HIV response, has been racist, has been transphobic, has been misogynist, has been classist. We focused a lot on kind of populations that, or people that have a lot of resources to face the challenges in their lives and not been so keen to face, what's racist in our society, what's transphobic, what's misogynist, what's classist in the way that we approach, HIV. And we, organizations have been slow to kind of really embrace that. When I think about ways in which organizations don't take on HIV criminalization, for instance, I think that that's really about classism or respectability politics or racism, that they think it's okay to police people living with HIV and hold us legally accountable for things for HIV criminalization in a way that other people aren't held accountable. So I think when we think about these ongoing challenges, we have to look at that. We have to look at the lack of funding. I don't see a lot of one of the exciting things about the Positive Organizing Project is that it is about leadership and advocacy, and that's really the center of it. So if you're sitting there thinking, what can I do for this project? What ways in which I can approach positive organizing? Start with leadership and advocacy. Think about how, what would make leadership, what would PLHIV leadership look like in this community, and talk to people living with HIV. I see on a lot of the people attending, I see a lot of people I know, so that's great, and it's great to see those of us in the community actually being able to define what leadership looks like in our community. One challenge that we talk lightly about is this movement from terminal to chronic illness, and it has presented complacency at the organizational side and the community side. So, after treatment was available, we saw a lot of organizations kind of go, you got HIV, we'll get you on medication, you'll be fine. And that's not true. Medication is great, and access to medication is vital and important, but we also come to the table with lots of other challenges. Do I have a substance abuse issue? Do I have mental health issues? How does this organization kind of invest in healing those wounds and helping build a community where people have leadership or have the ability to speak out? I also think that when we think of AIDS Incorporated, the irony here when we see AIDS Incorporated and medicalization is that the professionalization that happened in the 90s and the 2000s in the HIV field left a lot of us out of the HIV field, left a lot of us out of the program management positions or any kind of senior positions. And now that the medicalization has happened, I think in the last 5 years we've seen a real heavy push to the federally qualified health centers and to other healthcare systems to really handle HIV. We've seen how the HIV organizations have actually been pushed out of that space. So how those HIV organizations, the same way they professionalized, are now being pushed out by clinics. And I think it's interesting to note. But I also think we need to think about how do we involve the clinics in leadership development of people with HIV? What is our role in that? What is our role in having a meaningful voice in the healthcare setting? And how do we advance PLHIV leadership in that space? So this idea of consumers, and one of the things when we think of the healthcare space is when they refer to us as consumers, that's really not the most empowering thing to be told that you are. I often, I, like many other people living with HIV, have had that moment where I just had to say to somebody, I have HIV, that's why you have a job. And you need to kind of rethink how you're treating me in this setting. And I think that that's something we need to think about is when people see us as consumers, they see us as helpless and passive, and we're really taking something away from them. And we're kind of feeding off their resources. And I don't think that's true. I think that they only have the resources because we exist. And I think that we need to be something else. We need to be able to name ourselves. We're not just the consumers. We're not just the clients. I think that's a real challenge for a lot of organizations to share power with us. And it's necessary. If the one thing they can do is stop calling us consumers, I might be happy with for like a minute. But I think we can't undermine the ongoing challenge to meaningful involvement in people with HIV without addressing the fact that we do live with chronic illness, we do have mental health challenges, that it is very stressful to encounter all of these challenges and to keep on organizing and keep on providing leadership. So we need to create spaces where people can also process that trauma. One thing to think about is how do we, when you're looking at your organizations, you're looking at your region, think about how white supremacy and misogyny act themselves out. Are the spaces where leadership speaks, are they all white? Are they all men? Are they all cisgendered? And think about how to change that. What would be necessary to change that? Is it about access? Is it about building people's voices? Is it about institutional power? Does the organization believe that they are quote-unquote colorblind? Because when we talk about race-neutral narratives, we're also, we're undermining the work of people of color as well as our allies, because color blindness is not real. We can accept that race exists. As a person living with HIV, as a person of color living with HIV, I know that race exists. I experience it. And I think that it's important to fight that. So if the organization is really like, oh, we don't see race, think about, how can we uplift that voice? How can we uplift these ideas? How can we build a better table for people to be able to participate in? And that's going to look different for all of us. So depending on what your space is like, depending on the cultural background of the folks involved, depending on the resources in the local community, what are the social norms? These are all things to think about. When we talk about movement leadership, who's at the head of the table? Are they people that have been there for a long time? Is there a space for other people to come up? Do these folks represent the folks in the community that are impacted? And that's not going to be the same everywhere. If you're in Maine, the people living with HIV look very different than if you're in DC or in South Florida. And I think that that's something that all of you should really be able to nuance and talk about in your proposals or in your positive organizing project, is really think about, what does the movement leadership look like? What could it look like? What should it look like? And how can I get it there? Anti-Blackness is pervasive. We see that all the time. I've had discussions where, people throw, when you talk about Black Lives Matter, their response is, Blue Lives Matter, whatever they're going to say. All lives matter, and they don't understand the core question there is, why can't Black lives matter? And I think that that's something that we have to address as a movement, but also organizations haven't really addressed kind of how anti-Blackness can be insidious. Do people think it's okay that African Americans and people of African descent are more highly policed than any other population? Do we think that that's okay? Why? And I think that that's a conversation that's possible with the Positive Organizing Project. I can't imagine CDC funding it, but I'm happy that, that we have philanthropic partners like ADDE United, where people can have that conversation in community and really build up this kind of, what does meaningful involvement look like? How can I make it meaningful in my space? So we have to think of structural violence. So when we talk about structural violence, we think about things like homelessness and poverty, healthcare access, HIV criminalization, the war on drugs, and these are structural violences. So if people are making choices between, going to a medical appointment or making sure that their kid is able to go to school, most likely, most people are going to pick their kid going to school. That's structural violence because their healthcare is impeded by the fact that they don't have the resources to get their full life done well. Done in a way that they want. And we need to look at that, so ask yourself the question, what stops people from being in this space? Is it because of stigma? Is it because of poverty? Is it because they feel like no one will understand them? Is it because they're afraid of being out? And think about that when you're organizing for meaningful involvement. So with that, I think I'm switching to Nana.
No, actually it's me.
Okay, thanks.
That's all right. Thank you, Andy. So just again to clarify, we've talked a lot about NEPA, about the meaningful involvement of people living with HIV and AIDS, and that is the term that is most commonly used in the United States. Globally, this is also a movement, and it is called GEPA, the Greater Involvement of People Living with HIV and AIDS. So as you start to look into this, those would be the terms that you could actually do searches on. And again, it goes back to meaningfully involving. And so when we talk about meaningfully involving people, this is not tokenizing. This is not asking people to be strictly consumers. It is giving people a voice. It could be having an empowered CAB. It could be having people living with HIV on your board of directors. It could be a number of things, hopefully some new exciting ones that might come out as grant proposals in this project. And part of the reason why we're doing this webinar is that meaningful involvement of people living with HIV and AIDS is not commonly supported. It might be understood, it might be part of an organization's mission statement, but for granting to develop this positive leadership and to really develop leaders living with HIV in a meaningful way and impacting organizations, this is a pretty unique pool of money, which is why we've been so specific about talking about what is meaningful, what are barriers to being meaningful. So again, it is just about involving people with HIV in everything that impacts their lives, the program, the policy, and the funding decisions, and ensuring that people are able to participate in these important decisions, which might require a little bit of extra support. And so that could also be something that you would seek to address in your grant. What are barriers to involvement that people living with HIV what are challenges to their participation in your particular area, and how, in partnership with them, as you're drafting this grant, you might seek to address that. It goes back to, one of the statements that we have from the National HIV/AIDS Strategy, which is that people living with HIV are the subject matter experts in our lives, and we seek to support that involvement. As we look at GEPA, the global conversation around involvement, there are a couple of really important, significant documents that show that this has been a conversation not as long as the Denver Principles, but since 1999. UNAIDS created a document called Principles to Practice, Greater Involvement of People Living with or Affected by HIV and AIDS, and it called out these two important points, that you need to recognize the contribution that people living with or affected can make in response to the epidemic, and that it is also important to create space within society for involvement and participation in all aspects of the HIV response. And this continues to be true today as we're talking about in the epidemic conversations. These conversations can be supported and enhanced when people living with HIV are a part of the conversation. And if they are not, you can actually tell because it tends to not have as much applicability as conversations that do involve people living with HIV. It is often easy for people to say that in 1999 that statement came out from the UN. So I like to say that in 2009 it was further supported with a policy brief, and that was also from UNAIDS. And so they continue to say that the involvement of people living with HIV is crucial to halting and reversing the epidemic, and that without people living with HIV being involved in these decisions and at the table, that there is no progress that can be made. And so we just like to share those documents to know that this is a continuance on a global level and can support and inform a lot of the work that we do here nationally. There are some barriers to meaningful involvement, and here are some organizational examples. As I mentioned, NEPA can be implemented on an individual, an organizational, a community, as well as a political basis. But when we're talking about organizationally, here are some things to consider, which is that oftentimes hiring practices at AIDS service organizations or community organizations prevent clients or people living with HIV from applying. It could be that it is as specific as someone who is a client is not allowed to apply. It could also be, as Andy mentioned, some pretty restrictive requirements around education. Oftentimes the lived experience of people living with HIV is as valuable in providing services as a degree, and people have stepped back from the educational system for a variety of reasons and might not have a degree which allows them to qualify for a position. So we encourage people and organizations as they are creating job descriptions that they include lived experience, not just college degrees. Another barrier to NEPA is that oftentimes board bylaws do not require people living with HIV. We have looked at, and through the Positive Organizing Project, we have reviewed many bylaws for organizations, and we find that some specifically call on a number of people living with HIV to be part of the board, to be voting members, to be very engaged, and other boards do not. And we know that unless you specifically call out PLHIV participation in boards, that oftentimes it is easy to not fulfill that, and that is a real barrier to meaningful involvement. Community advisory boards. Most organizations have one, especially people who receive Ryan White funding or other state funding are required to have a community advisory board. But there is a difference between a community advisory board where you ask people to show up for the chicken lunch or chicken dinner, as one of my friends has said, versus a community advisory board that is empowered, that has a way to connect and share their thoughts and concerns with the executive director as well as the board of directors, and that is not staffed or run by somebody from the organization. When we talk about free sharing of ideas from people living with HIV, having a staff member facilitate that meeting can be a suppression on people's ability to share what their concerns are about the organizations or even what they think has been going on and been done well. A lack of organized input from PLHIV. Until the caucus came along, there was a bit of a gap around meaningful involvement of people living with HIV, even organized by ourselves. And this continues to be an ongoing challenge. Where do people join? Where do people living with HIV share their thoughts and their concerns? It could be through the caucus. It could be that through this grant you want to start a network of people living with HIV in your state or your area. So we just encourage all of that because organized input amplifies the voice and brings the power back to the people who are most impacted. Sadly, a lot of organizations are kind of almost anti-NEPA by doing programming for people living with HIV, not by people living with HIV. We all have seen stories of clinics that have created a program for women living with HIV and yet have had it during traditional business hours, have not provided child care, have not taken into consideration how women often will need to bring their children or other family members with them, and have not provided a place for those family members to sit that's not part of the clinic. And that would be something that if people living with HIV are part of the planning can be informed by those challenges as they are created, not after a program has been put in place and funded and then unfortunately not as successful as possible. And then of course we come back to people living with HIV who are speaking do not reflect those most impacted by the epidemic. There are groups that indeed need to be brought to the table that are not part of conversations, and these go back to the institutional barriers. The racism, transphobia, misogyny, and so much of that has kept the power of the voice of people living with HIV kept in some very white, cis, male hands, and we need to seek to expand that so that we always ask if those most impacted by the epidemic, most impacted by the policies, most impacted in that geographic region are the ones who are at the table facilitating the conversation about what will impact their lives. So hopefully that gives you some thoughts about how NEPA can be challenging. And with that, I will turn it over to Nana.
Thank you so much, everyone. So I think what we wanted to talk about now is just like a couple of organizational examples that can present barriers to NEPA. So for example, hiring practices that may prevent people living with HIV from applying for jobs. So for example, not having, sometimes organizations may have policies that say clients can't apply for jobs, or there's a way in which folks risk losing services if they apply for a job. And so it's just important to think about how those things can actually limit our ability to hire from the communities most impacted by the epidemic, and think about ways to address those creatively. Secondly, not having bylaws in the board of directors protocol that require participation from communities most impacted. So here it says people living with HIV, but I think as you've heard, we define meaningful involvement much more broadly. So does the board of directors have criteria for participation at the board level by people of color, by people maybe who don't have formal education, by young people, by people living with HIV, by folks of trans experience? Is that data even collected? That data can be really important in terms of helping to strengthen how the board can be at a leadership level responsive to the needs of the community. And then, as we've talked about before, making sure that those who are representing the community of people living with HIV really are representative of the most impacted communities and the communities that the organization is actually serving. So if there are people living with HIV participating on your community advisory board or on your board of directors, but they actually don't represent the majority of what your client base looks like or your service delivery base looks like, think about who your constituency is. How could you change that? And so that's part of what the POP grant really wants to support you to do, is to have these types of organizational interventions as a part of the work you're doing. You can go to the next slide. Oh, maybe I can go to the next slide. So also a clear commitment to address racism, classism, educational privilege, different forms of privilege within the context of an organization or institution is really key. And, folks aren't always going to be comfortable. So part of what we talk about is, what does it look like to create safe space, and what does it look like to create courageous space? Having conversations about what it means to be a truly anti-racist organization, especially as we know many institutions serving people living with HIV are what we call snowcap organizations. They get sort of progressively lighter as you go up the leadership ladder. And so those conversations are not always easy to have, but they are important if we're really talking about having a true commitment to meaningful involvement of the communities most impacted by the epidemic. And so that's just one example. The similar types of discussions and interventions may need to be had around creating spaces that are truly inclusive and supportive of people of all genders, as clients, as constituents, as staff members, as leaders. There might be different types of policies that need to be set up and procedures. So really thinking through what that looks like and how an organization could take steps to addressing these types of institutional barriers to meaningful participation. That's a piece of what the Positive Organizing Project is open to supporting and resourcing as well. So really thinking about meaningful involvement in an intersectional way. And then finally, in terms of types of things you might want to consider including in your grants, ways that we can tell that meaningful involvement is really happening in your project. These are just a few metrics that we might be looking for. So are people living with HIV representing the communities you're trying to reach involved in the proposal development process? Have they been involved from the beginning? Are you speaking to that? Are their voices actually in the grant? Are you showing that you're a commitment as organizations to hiring from the communities you're trying to reach? Are people living with HIV and folks representing the impacted communities actually written into the budget that you're proposing? Are they written into staffing positions? Are they written in meaningful roles? Or sometimes people with HIV are written in as stipends, and stipends are not a bad thing, but are there ways to actually increase the level of leadership, decision-making, and authority within the context of the budget. We all know that budgets reflect values. And so from a funder perspective, often when they're looking at your budget, they're looking at what type of program are you really trying to create. So are people with HIV in your staffing and implementation plan? Are you talking about how they're going to be leading the project, through their roles, have decision-making authority? How do folks living with HIV from the impacted communities define the priorities and the messages? And then, creating mechanisms to gather input in ongoing ways from people living with HIV. So making sure that that input is accountable, that it's ongoing, and that there's a clear plan to make sure that it doesn't just happen one time. So, having like one focus group putting together a proposal does not necessarily demonstrate an ongoing commitment to take input from people living with HIV. What would? Maybe something like setting up an advisory body, a consultative body, maybe a commitment to build leadership and power among a PL-HIV constituency or base by expanding their ability to even participate in decision-making conversations about the programs, the policies, the campaigns that you're working on. And so, ultimately, part of what we're hoping to see is a real commitment to build power among the communities most impacted by the epidemic. And there are lots of ways that can be done. And you all probably have some really great ideas about what that looks like. So we're definitely looking forward to hearing about them. I will turn it back to Andy in case, Andy, did you want to add anything else specifically about the grants?
No, I love that you ended with this whole idea that, we're looking for their ideas and we're looking forward to it. We don't, NEPA can look like a lot of things in different places, and I really recommend for people to think about, if you've talked to people living with HIV and really asking, locally, not just how, if they feel like it's good, but also what they feel like could be added, and thinking about the spaces that aren't full. And so when we think about that, and being able to have that conversation, because you'll see your project will change when you start having those conversations. And if you are a person living with HIV and you think, I know exactly what my community needs, I always recommend, talk to some more people and make sure that this kind of either challenges people in the right way or doesn't hit people in odd ways. So that's all I would add on that. I think a great idea is to look at this NEPA resource that we worked on with AIDS United, and I think you'll see that it's available at aidsunited.org/resources. Download it, think of it as you're working on your projects and envisioning what your next year could look like and what your next year could build to. And I think that would, it's a good way to conceptualize where you might be going. And with that, I believe we're opening up to Kiva, correct? Nana?
Yes, that's correct. So I'm going to go ahead and turn this next part of the presentation over to Kiva Lay. And Kiva Lay is an amazing person who I've had the privilege of getting to know over the last, I guess, basically 6 or 7 months or so. She's a community organizer at the Pop Ohana Project, which was one of the grantees in this past cycle. And the Pop Ohana Project strives to bring the culturally diverse voices of people living with HIV together from across all the Hawaiian Islands. It's organized by people living with HIV for people living with HIV, and is really trying to create a family atmosphere of support and advocacy at the same time. And so, and Pop Ohana is housed at the Life Foundation, which has been serving people living with HIV in Hawaii for over 30 years. And so I'm really excited to be introducing Kiva Lay.
Aloha, everyone. Thanks for including us in this presentation today. We're really, really proud of what we were able to do with this POP grant, and so I'm here to share our experience and how we've let this POP grant able us to grow within NEPA standards. So First, I'd like to tell you a little bit about Life Foundation. We are Hawaii's largest and oldest HIV and AIDS organization. We started out in 1983. It was Hawaii's first response to the AIDS epidemic. And we've grown to include capacity building across the Pacific for other countries, including Saipan, Micronesia, Samoa. And so we're very proud of the work that we've done in the Pacific, and we're very happy that we were able to connect with the HIV Caucus and ADDE United and bringing these NEPA standards and these NEPA ideas to Hawaii. So I can change the slides myself, can't I? So when we first read about this POP grant, we knew that we wanted to bring some new education and updated information to our community, the people living with HIV in Hawaii. And so we started our efforts on just getting updated with new ideas and new meaningful involvement and creating leadership. But I think what really happened for us, or for me personally, was when I was able to go to Washington, D.C. in January for the POP convening, which brought together all of the grantees. We were able to share ideas. We were able to network within each other. But most importantly, I sat in on my first NEPA presentation given by Barb. And it really, as a Native Hawaiian transgender woman living with HIV, it really kind of stirred up a lot of emotion and passion within me to kind of really reflect on our own agency and our own ideas of what that meaningful involvement was in Hawaii and how it was in play already. And I quickly realized that there were holes in our services because we didn't have a lot of inclusion of my community, the people living with HIV in Hawaii. And so I first thought to myself, like, we really need to change our whole grant. Like I wanted to change everything and make it different, and what I thought was going to bring this NEPA to everybody across the state. And luckily, everybody kind of riled me in, and I was able to really think of an idea of just making this Ohana idea bigger and better. So our original objectives was to kind of form an Ohana or a family that was able to kind of compare notes, that was able to educate each other, that was able to take what they've learned to their own communities across the state, and really address the stigma and shame and target elimination. And we wanted to be able to empower this Ohana to be able to spread messages that was in line with what the rest of the country was thinking of people living with HIV. Let me just briefly kind of explain what the word Ohana really means. So Ohana in Hawaiian means family, but it's more or less a unit and more so a concept. Ohana doesn't necessarily have to be your blood brother or your blood sister. It doesn't necessarily have to be your mother or father. You'll come to Hawaii and you'll immediately see people calling you cousin, or you'll see people calling you sister or brother. You'll meet people and they'll refer to elders as auntie and uncle. And it really is a concept that when I put myself in that frame of mind where you are my brother, you are my sister, you are my aunt, you are my uncle, I have a deeper connection and I have a deeper commitment to you. And that's why we wanted to use that word Ohana to describe this group, this meeting. And so we kept that Ohana concept when we wanted to grow this POP idea into something bigger after that convening in January. And so what we ended up coming up with was we decided that we were going to reinvigorate our community advisory board for Life Foundation itself. I came home from Washington, D.C. I immediately called a meeting with my executive director and our prevention and our care director. And I wanted to share with them what I learned about NEPA. I wanted to share with them what meaningful involvement really meant to the rest of the country. and how it was working in other parts of the country and how it was kind of missing in some areas of our own state. And thankfully, and I should have known better, but they were completely on board. I told them that I wanted to create more leadership. I wanted to be able to include more people living with HIV in the decision-making process here at Life Foundation, and that was my whole idea. And so they were, of course, they were on board. They were very excited, and so we proceeded with setting up this cab. And what happened was the timing was perfect. And so the state was reinvigorating their community planning group. And one of our directors was actually helping in the process of reforming that community planning group for the state of Hawaii. And so we were able to touch bases, and we were able to compare notes, and we were able to appoint 2 of our Ohana POP leaders onto the community planning group for the state, and the rest of these POP leaders were going to be a part of the community advisory board of our own agency. And these 2 CPG members would be able to come back and forth between the CAB and the CPG and really spread the word of what our community advisory board here at Life Foundation envisioned for people living with HIV. And it was a beautiful, beautiful, beautifully timed thing that happened, and I just kind of felt like it was all lined up and meant to be, and really put NEPA in action here. So our objectives kind of grew after that convening, and so it was part of the best process during this year was that we were able to learn more as we were going along through the help of ADDE United and the HIV Caucus. So what we exactly did in our with our POP events, with our gatherings, is we created sessions, 3 sessions over the period of 30 days. We had one every 2 weeks, and we wanted to give our participants time in between each session so that they really could kind of take in what they had learned for that day. They could really think of ways that they could kind of bring this leadership role into their own personal lives at home where they were and on the community level. And so we spread them out through 30 days. We had one every 2 weeks. And it was a total of 21 people came. At first, I thought that we needed to touch, 50, 60 people living with HIV in Hawaii. And really, we identified that we needed to get a handful of important people that we felt like had the capacity to become advocates, that had the capacity to become leaders, and really had a passion for their own life and living with HIV. And so we selected, with the help of other agencies on other islands, we selected a total of 21 people to attend. They were from across the state, from Kauai all the way down to Hawaii, and we all met here in Honolulu over those 3 events. And we talked about things like the power of our own stories, and we talked about cultural humility and positive or person-first language, which all of these things we grew our own capacity through ADDE United and through the HIV Caucus, and we were able to bring this to our own community. We taught them about the continuum of care, and we helped introduce them to the power players in Hawaii, really important people who make decisions about HIV care in Hawaii. So the Department of Health, HIV Prevention Branch, their whole staff came and attended this event on the last day to introduce themselves to our POP leaders. We had executive directors from other agencies come and introduce themselves and talk about their roles in the community, as well as the role of their agency in the community. And I think what happened during these 3 days is you could see the leadership and the empowerment kind of grow within our group. And the last day, we were able to establish that every single one of them really wanted to be included in bringing more leadership amongst people living with HIV. We asked the question, if you were selected to be a part of the community planning group for the state, and if we were to continue having community advisory meetings throughout the year, would you want to be included? And across the board, every single one of them said yes. We had 4 transgender women. We had 3 biologically born females. We had 2 heterosexual men, and the rest identifying MSM. And all of them were wanting to be a part of it. And so what I had realized was I had created, with the help of other agencies across the state and my own agency, we had created a big, diverse group of really well-seasoned and educated leaders. They knew what HIV services were happening in Hawaii. They knew the role that they played and how important their experience was to continuing to bring quality services to Hawaii. And so this is how we grew. We are now working on putting together this statewide community planning group, and 2 of those POP leaders are going to be a part of that community planning group, and we're continuing our own community advisory board within our agency with those POP leaders. And so they continue to be updated with new information, and we continue to refer back to them for their own input and their own ideas about what they need and what our community needs. We're really, really proud of what we were able to do with this. And I have to say it helped us open up our minds more to what we could do with that POP Year 3 grant after we went to the convening. That whole experience really kind of inspired a lot of my own passion as a person living with HIV. So again, thank you so very much for letting me share this experience, because it was a really, really empowering moment. So thank you very much. And that's all from me, but I guess we're going to be opening it up to questions.
Yes, hi, this is Julio again from AIDS United, and I just wanted to, for this portion of the question period, we'll allocate about 5 to 10 minutes for any questions that you may have for any of the presenters regarding NEPA or anything that was just discussed. If you could, I'm sorry, I didn't specify, if you could go ahead and put any questions into the Q&A box that's on your screen towards the lower right. So we did have a couple of questions come through. Just to let everyone know, this is being recorded. We are aware that folks, some folks may not have been able to participate. So it will be made available online. The slides themselves will be made available online as well. So one of the questions that we received is, do you sample bylaw amendments to reflect NEPA principles?
Can you repeat the question? I'm sorry.
Sure, Nana. It says, do you sample bylaw amendments to reflect NEPA principles?
Yeah, I'm not sure exactly how that question was meant, but so for example, you could show.
I'm sorry. So we got a follow up. It was, do you have sample
okay.
bylaw amendments?
Uh-huh. Oh, that's a great question. you know, that's something that if you were to put into a POP grant, that's something you want to work on, that's definitely something the Caucus Technical Assistance Providers could help you with. So that's, you know, that's like a, like if you were applying for a positive organizing project grant and wanted to show that you're trying to increase meaningful participation, you could say this is one of the things we're going to be working on as a project during this grant period. And we definitely have examples that we could help you with.
Great. Thank you, Nana. So I've got a couple of questions that are more specific to the grant itself. So I'm going to be speaking about the grant in another piece and address those. If I don't address them in the content, we will get back to them. And we have them in the chat box. So it looks like that was about it. So we, I think, can go ahead and I would like to express my gratitude to our presenters today for doing such a phenomenal job, not only of talking about meaningful involvement of people living with HIV/AIDS, but for putting this together and really sharing sort of on-the-ground experiences of people living with HIV in leadership roles.